Hydrochlorothiazide, or HCTZ for short, is one of the most commonly prescribed medications for high blood pressure and fluid retention. In fact, millions of people take it every single day, and for many, it works well. But here's the thing most people do not realize. While this little pill can be effective, it can cause some side effects that are definitely worth knowing about. That's why in this video, we are diving into 10 surprising side effects of hydrochlorothiazide that your doctor may not have mentioned, but you absolutely need to know. And trust me, when we get to number 10, it might completely change the way you think about this medication. Welcome back to the channel. And if it's your first time here, don't forget to hit that like button and subscribe to the channel. Number 1. Electrolyte imbalance. Hydrochlorothiazide is a diuretic, which means it works by helping your kidneys remove excess fluid, but in doing so, it flushes out essential minerals too, especially potassium and sodium. When your potassium drops too low, we call that hypokalemia. It can lead to muscle cramps, heart palpitations, or even irregular heartbeats. On the other hand, when sodium gets too low, known as hyponatremia, you could feel unusually tired, confused, or develop headaches. In more serious cases, it can even trigger seizures. The tricky part is that these imbalances do not always cause symptoms right away, but they can build up over time if you are not watching them. That's why doctors should often recommend regular blood tests to monitor electrolyte levels. Number 2. Increased blood sugar. This one often surprises many people. How can a medication meant to protect your heart quietly be increasing your risk of type 2 diabetes, especially if you already have insulin resistance or prediabetes? Well, here's what's going on. Hydrochlorothiazide can raise your blood sugar levels, which may not be a big deal for everyone, but if you are pre-diabetic or living with diabetes, it can complicate your blood sugar control. That's because hydrochlorothiazide can reduce insulin sensitivity, meaning your body does not respond to insulin as effectively as it should. Now, this does not happen to everyone, but research has shown that in some people, thiazide diuretics like hydrochlorothiazide can lead to measurable increases in fasting glucose and A1C, which is your 3-month average blood sugar. So if you are taking hydrochlorothiazide, it's a good idea to keep an eye on your blood sugar and monitor for any changes. And remember, lifestyle choices play a huge role here. A diet rich in fiber, low glycemic carbs, and regular movement can go a long way in helping balance blood sugar. Number 3. Increased uric acid or gout flare-ups. Yes, I am talking about gout, that sudden fiery pain that often hits your big toe. You see, hydrochlorothiazide, or HCTZ, can raise uric acid levels in your blood, which may trigger gout flare-ups, especially if you have had them before. Here's why. HCTZ makes it harder for your kidneys to clear uric acid. As that uric acid builds up, it can form sharp crystals that settle into your joints. And if you have ever had a gout attack, you know that the pain is no joke. That's why, if you have dealt with gout in the past or know your uric acid tends to run high, it's important to bring this up with your healthcare provider. Number 4. Photosensitivity, or simply put, sun sensitivity. Hydrochlorothiazide can make your skin more sensitive to sunlight. In other words, you are more likely to get sunburned or develop a rash after even a short time in the sun. So what can you do about it? Well, if you are planning to be outdoors for long periods, use a strong SPF, wear protective clothing, and try to avoid peak sun hours when you can. Number 5. Erectile dysfunction. Thiazide diuretics, including hydrochlorothiazide, are known to affect sexual function in men. This may cause difficulty getting or maintaining an erection, or problems with ejaculation. So why does this happen? Well, these medications can reduce blood flow, disrupt hormone levels, and interfere with nerve signals, all of which play a vital role in sexual performance. But here's an important point. High blood pressure itself can also contribute to sexual problems. Unfortunately, many men never bring it up with their doctor, assuming it's just part of aging. The truth is, it does not have to be. If you're experiencing these issues, do not suffer in silence. There are effective treatments, medication alternatives, and strategies that can help. You just need to start the conversation with your healthcare provider. And remember, beyond medications, lifestyle changes matter too. Maintaining a healthy weight, quitting smoking, and staying active can all improve sexual function and help you feel better overall. Number 6. Frequent urination. This one's not exactly a surprise, but it's still worth highlighting. You are going to be heading to the bathroom more often. That's the whole point of hydrochlorothiazide. It's a diuretic, designed to help your body get rid of extra fluid. But here's the key: the time you take it really matters. Make sure to take it in the morning, not at night. Otherwise, you will find yourself waking up at 2 a.m., making bathroom trips instead of getting the deep, restful sleep your body needs. And while it might seem like a small inconvenience, regularly interrupting your sleep can add up, leading to fatigue, mood changes, and even making it harder to manage your blood pressure. Number 7. Vision problems. This is rare, but serious. Some people experience temporary blurry vision or nearsightedness after starting hydrochlorothiazide. This can happen due to fluid shifts or changes in eye pressure. In very rare cases, it can even trigger acute angle closure glaucoma, a sudden increase in pressure in your eye that requires emergency treatment. So if your vision changes suddenly, or you experience eye pain, redness, or halos around lights, don't wait. Get it checked. Number 8. Muscle cramps or spasms. You know those sudden, sharp muscle cramps that wake you up in the middle of the night, usually in your legs. They are often linked to an electrolyte imbalance, especially when potassium and magnesium run low. And as already mentioned, both of these electrolytes are flushed out of your system by hydrochlorothiazide. So if you are dealing with night leg cramps, random muscle twitches, or even jaw tightness, that imbalance could be the reason. The good news is that simple things like Epsom salt baths or adding magnesium and potassium-rich foods like almonds, avocados, and leafy greens can make a real difference. But again, do not just guess. If cramps keep showing up, it's important to get your levels checked. Your doctor may recommend a potassium or magnesium supplement to get you back in balance. Number 9. Weakness or fatigue. When you first start taking hydrochlorothiazide, it's pretty common to feel a little weak or unusually tired. That's usually just your body adjusting to the lower blood pressure. Sometimes, though, that tired feeling can also come from shifts in important electrolytes, things like potassium, magnesium, or sodium. But here are simple steps you can take to manage it. Make sure your blood pressure is checked regularly, and support your energy by eating foods rich in minerals, keeping up with gentle movement, and practicing good sleep habits. Number 10. Kidney problems. Now, here's where it gets a little ironic. Hydrochlorothiazide is often prescribed to protect the kidneys by lowering blood pressure. But in some cases, especially at higher doses or when combined with other meds, it can strain them. So how do you know if your kidneys are taking a hit? Well, the tricky thing is, you may not feel anything at first. That's why regular blood tests matter. Your doctor may need to check your creatinine and GFR to see how well your kidneys are filtering. So if you are taking this medication long-term, make sure those labs are on your radar. And there you have it. Remember, knowledge is power, and you have the power to make informed choices for your health. Thank you for watching.